has potentially different coverage. So there's flexibility with the benefits that can be provided. So today we're not going to get into the details, specific details of what coverages are there, because they're going to be different for everybody. But looking at the vendors that comprise the program, as mentioned, Medavie Blue Cross provides the health and dental and emergency travel benefit. We know that as a plan member, this is likely the piece of the benefit plan that you're interacting with on a most frequent basis, on a day-to-day basis, as you make your health and dental claims. Desjardins is the insurer that provides the life insurance, dependent life, and long-term disability insurance, should your municipality provide that coverage. Long-term disability is your income replacement. So should you be injured or ill for a period of time and unable to work, you would receive an income benefit for a certain period of time, depending on the terms of your plan. Within the plan as well, Desjardins also provides an LTD early assistance benefit, which is available to members on a voluntary basis. So if as a member you are absent from work due to illness or injury for 10 days, so about 2 weeks, you can access the LTD early assistance program. Desjardins provides a rehab specialist that will reach out to you as a member and help understand your absence from work and help to determine if there's any supports that they can provide. So it could be, as an example, if it's a physical type injury, they could help coordinate and provide physical rehab for you. If it's a mental health type absence, for example, they could help support and provide some mental health support for you. So perhaps it might be a cognitive behavioral therapy program, for example. And through the early assistance program, any treatment or support that is provided is at no cost to the member. So during that period of absence, they would coordinate that, and there'd be no out-of-pocket cost for the member there to help them return to work. So the goal is to help and support you as a member in getting you fit for return to work. The accidental death and dismemberment coverage is provided by Beneva. They were formerly SSQ and recently underwent a bit of a merger. So you may be familiar with that new company named Beneva. And as mentioned, TELUS Health provides the EFAP, or Employee and Family Assistance Program, to the benefit plan. They just recently, within the last month or so, underwent a rebrand there. So you may be familiar with that EAP plan and know it as LifeWorks. So it's just been rebranded. There's not been a change in carrier there. And Carrie will go into more detail on that today. As well, for those that do have health coverage with Medavie Blue Cross, you also have TELUS Health Virtual Care benefit available to you. A few years ago, about 2 years ago, that was known as EQ Care, and that was purchased by TELUS Health. So you'll see it now as TELUS Health Virtual Care. And Jacqueline will walk us through a bit of a more detailed overview on that. So as mentioned, I'm with Hub International, which you see in the bottom left corner here. We're the employee benefit plan consultants. So we work with the NSFM and each municipality in terms of their benefit plan. And the NSFM, or Nova Scotia Federation of Municipalities, is the association plan sponsor. There is an established health and benefits committee that's made up of individuals from different municipalities that oversee the plan itself and help to make decisions in terms of what coverages might be available for municipalities to include in their plan. Looking a little closer at Medavie Blue Cross and in terms of the health and dental benefits, as mentioned, each municipality potentially has different health and dental benefits there. As a plan member, you do have access to tools and resources from Medavie Blue Cross to help you make the most of your plan. There is an online plan member service site that Medavie has where you can access your detailed plan information, coverage lookup, your plan booklets are available there. You can submit claims online through the plan member website. You can view your Medavie Blue Cross benefit ID card that you would need to provide to, say, the pharmacy, your dentist, a paramedical provider, vision provider, as examples. So you can find that digital benefit card available online or have the ability to print one yourself if you like a physical copy. So you can log into the plan member website at the Medavie Blue Cross website there, medaviebc.ca, and navigate yourself to the plan member section. You need your Medavie certificate that's on your benefit card to initially register and log yourself in there. And if you'd like to speak to somebody at Medavie directly, if you have questions perhaps on the coverage that's available to you, or you'd like some clarification or more detail, you can reach out to Medavie directly at their toll-free number that's available there. As well, they also have a mobile app that you can download straight to your phone. Contains much of the same functionality that the plan member website does. So again, you can submit claims directly from your phone, search benefit details and do coverage lookup if you're wondering what your coverage is, and view past claims. I understand as well that Medavie recently had an update to their app and plan member website where you can see a little more detail about as your claims are processed, kind of where along the way in terms of that adjudication that the claim sits as well. One feature that they have as well is a lookup for a health professional. So you can input your location via postal code and perhaps, let's say you're searching for a physiotherapist, and it will tell you any practitioners that are in your area as well. Medavie has a number of preferred pricing in terms of digital health solutions that they provide as well. So by virtue of being a Medavie Blue Cross plan member, they're providing you some additional benefits, which we'll take a bit of a closer look at. One of those benefits is known as managing chronic disease. So it's essentially access to some health coaching that's specific to certain covered conditions that you see there. So asthma or COPD, diabetes, high cholesterol or blood pressure, or smoking cessation. So through Medavie, you can access some health coaching, which can help you keep on track with these types of chronic diseases. We know typically that adherence to medication in these specific disease states sometimes can be a little lacking. You know, if people are not feeling well, they tend to take their medication, and then when they are feeling a little better, the adherence can drop off. So sometimes this health coaching can just provide a better understanding of the disease for you as a plan member, and can create some checkpoints to help you try to maintain that medication adherence and result in better outcomes. So the coaching's available, and should you access it, there's a cost to the service, and it's a reimbursable expense through your benefit plan. So depending on your benefit plan design, there'll be some co-insurance there potentially, but you can submit the cost for these claims as a claim to your benefit plan. Medavie also has what they call connected care, and that provides preferred access to some of these digital health solutions with preferred pricing to you as a plan member. So you can access the connected care programs by logging into your Medavie Blue Cross plan member profile on the website or through the app as well. And depending on the service and your plan coverage, again, you may be eligible to submit these services as claims through your benefit plan. Some of the programs available are noted here. There's a personalized medicine program, which allows you to complete a pharmacogenetic test that's based on your DNA, which will produce a report for you that outlines how you, as an individual, metabolizes different types of drugs. So you can take that report and review it with your pharmacist or your physician or whoever encompasses your medical team to help you or help them understand what types of drugs and how you metabolize different types of drugs, which will help you potentially get onto the right drug at the right dose in a quicker fashion. So there's a lot of benefit proven in some different spaces on this in terms of mental health type drugs or drugs that are used to manage pain, chronic pain. A lot of those drugs are often prescribed kind of on a bit of a trial and error basis, and this can help identify the drug for you that may work better. There's a mental wellness component there, so access to some ICBT or Internet Cognitive Behavioral Therapy programming that you can do at some preferred pricing. Again, should you choose to do that, you can submit those claims to your benefit plan as long as the practitioner is covered by your plan. So a lot of times we might see ICBT delivered through, say, a social worker, for example. If your plan covers social worker, then you'd be able to submit those types of claims there. There's also a virtual physio benefit that's available there. So again, I think pretty explanatory. Some physio available on a virtual basis that you can submit as a physio claim to your plan. And there's a few other modules there as well. So there's the diabetes care program, which can help send diabetes testing material directly to your doorstep, as well as a mindfulness program as well. Medavie also provides you as a plan member with a preferred kind of discounts and coupons to different vendors in a program that they call Blue Advantage. So you can find that through the Medavie Blue Advantage site as well. I think one we often hear from members that they use there is online with Clearly Contacts. So you can order contacts online and get some preferred pricing there, and then go ahead and submit those claims as a vision claim to your plan, depending on your coverage. There's also a digital health and wellness platform through Medavie that they provide called My Good Health. So a number of different tools there that you can access, different health risk assessments, some digital health coaching, different challenges that are available online that you can work through yourself, as well as a large resource and health library in terms of health information and reliable databases to provide you with information. And in terms of the EAP, I'll pass it over to Carrie.
Great, thanks, Brad, and hi, everyone. I think, Brad, you can jump right on to the next slide, please. While that slide is coming up, Brad mentioned off the top that the EAP has been rebranded recently to TELUS Health. As you mentioned, we were LifeWorks, and prior to that, we were Morneau Chappelle. But it's all the same company and all the same services. We do continue to enhance our services, but that phone number that you have is still the same phone number. And what you can expect to see with some of the rebrand changes are just a different color scheme. And when people call the toll-free number, our phones are now answered as TELUS Health. So jumping into a quick overview of what's included in the program. First and foremost, I do want to mention that the program or anyone that uses the program does so voluntarily, and the service is completely confidential. My next slide focuses just on confidentiality, so I will elaborate on that a little bit more. Anytime someone uses the service, there's no, oh, can you go back, please, Brad? Sorry. Anytime someone uses the service, there is no cost to them or their family members to use anything that I will go over today. And our core services are available in both English and French. Should you require counseling in a different language, we have a translation service that supports over 220 different languages. And those that are eligible to use the program are employees, and that's full-time and part-time employees, your spouse or common law partner, dependents living in the same household up to the age of 21, or children away from home but attending post-secondary education up to the age of 25. And now with the next slide, please, I will speak a little bit more about confidentiality. It's really a cornerstone of what we do. We realize keeping employees' confidentiality is really key to making people feel comfortable that they can use the program. So absolutely no one will know that someone has used the program unless that person decides to disclose it. I do encourage people to talk about their experience because it could encourage someone else to make that phone call and get help. Some of the things we do to protect confidentiality is we will ask if we can leave a voicemail. We want to make sure your voicemail system is confidential to you. We keep all of our records in Canada. Our counselors are under strict regulations on how to keep their records and that they must be locked up. And then we keep them, excuse me, we keep them for 10 years and then we confidentially destroy them. And all of our online services and programs are secure, password protected. We have a team that makes sure we have the highest standards of confidentiality and security around those programs every year. And then the last point is that services are 100% confidential within the limits of the law. So there are a couple situations where we may need to break confidentiality. And the first is if there's a risk of harm to yourself or to another individual, we do have to get the correct authorities involved. And then secondly, if your records are subpoenaed by a court, we do have to abide by that and provide your records in that situation. So getting into more of the details on what the EAP includes and the services available, this slide has some different areas in our life where we may be struggling. And I like to put this slide up because I want people to think about EAP differently. Historically, it's been a program of, I need help, I have a counseling program, I will call EAP. But it's a lot more than that, and it can really help with everyday challenges that we're experiencing or just something new in our lives that we haven't gone through before, that we want that unbiased professional advice or consultation to help work through those everyday challenges or life situations that we're going through. Next slide, please, Brad. So how can we help with these everyday situations? Like I said, a lot of people know EAP as the clinical counseling. I won't spend too much time on that piece today. I will highlight that there's lots of different areas where we can support with the clinical counseling, anything from personal, emotional, family, relationships, work related. And then our counseling is provided either in person, telephone, video. We have some online programs. We have online group counseling as well. So we really want to get people to help in a way that works for them. On the other side there, you saw work-life services, and I'll go through each of those in detail. These work-life services are the things that can help with these everyday challenges that we're experiencing, and they can really be the proactive piece of the EAP. And I think they're really underutilized. The work-life services typically make up about 15 to 20% of all calls to our call center. So I think there's room to educate people on what these services are and get more people to turn to EAP first for some of these resources. So the first one here is legal consultations. This is a phone consultation with a lawyer, completely free of charge. You can access it by calling our call center. It's a great place to start. If you are looking for some legal support, you're not sure what your first step is, just call us and get that consultation. From that consultation, if you do need to retain legal representation, our lawyers can help do that with you. They can refer you to a lawyer that can take you on as a client. However, at that point, if you retain legal representation, there is a cost with that, and that cost is your responsibility and outside of the EAP program. But by going through our consultation first and getting that referral, you actually get a discount of it's around 15%, but I've heard up to 30% as well, depending on the specialty and the location. So great place to start if you do need some legal advice. The next one is financial consultation. It works quite similar to the legal consultation. It's a um, consultation with a financial advisor or a financial professional. They can help answer questions around a variety of subjects. We see a lot around divorce, credit or debit, planning, reducing your credit, how to plan for retirement, doing your taxes. A few years ago, we were doing our taxes and had some questions, and my partner and I were actually arguing about how to get help and who could help us. And then I realized we just needed to call the EAP, and we could do it from home. We did it together. It took about 15 minutes to speak with that advisor and had our questions answered. So again, if you're struggling and you're not sure where to go, make that first call to the financial advisor. Sorry, Brad, can you go back one? There's one left on that previous slide. The career services at the bottom there, that's similar to our EAP counseling service, but it's a career counseling program focused on some different areas of your career path. Do you need assistance with your career planning? Or career resiliency. Maybe you always had great fulfillment in your role and something happened and you're not really feeling it anymore and you want to just build your resiliency and become that top performer again. And then there's two other programs under career counseling. One is starting out. It's for students in high school or university that again just want that unbiased. They don't want to listen to their parents, but want that outside advice. And there's a retirement program as well for people nearing retirement and want that emotional support that comes with the emotional aspect of retiring. And you can go on to the next one. Then we have a few others under this, under the work-life services. We have nutrition. This is a consultation with a registered dietitian available over the phone. They can help with just general healthy eating planning or questions around weight loss, weight gain. Maybe there's a new fad or a new diet that you want to try and you don't know much about it. It would be a great place to start with our dietitians. Same thing if maybe you've been diagnosed with high blood pressure or high cholesterol and you want to adjust your diet to improve that condition. Again, our dietitians are there for that consultation and advice. The next one is family support services. This, again, it's a consultation program that is with one of our TELUS Health employees, and it can be for any area of your family life, whether that's planning a family. Maybe you're looking at adoption as an option and you're just not sure where to start. Having that consultation with our team, they'll look at what your goals are, if there's any financial restraints, and they'll give you a starting plan. Most of the times when we're in these challenging situations, it's so stressful just to start coming up with a plan. Having that consultation with our team, they do that work for you and they give you this starting plan with resources where you can take those resources away, they're validated, and then make the decisions that are best for you and your family. On the other end of that, elder care. As our parents get older and they might need help in home support or community programs, what does that look like? What's available in our communities? A lot of us return to Google or maybe Facebook groups for that information, where our family support team again can look at your situation, look at your location, look at your goals, and provide you with that information to give you a starting point and some resources. And then the final one there is TELUS Health Fitness. This is a fitness app that you can find through your website or your TELUS Health EAP app, which I will show you how to get to, but it's completely free. If you do a questionnaire, it can give you a 6-week customized program. If you don't want to do that, you can scroll through the different topics. There's high intensity, there's flexibility, Pilates, different classes there. And all the videos are designed to be done at home with no equipment. So it's a great alternative for someone that wants to do that physical fitness inside their own home. And on to the next one, please. So speaking of the website or app, some of you may have had the LifeWorks app downloaded before. If you do, all you need to do to get the TELUS Health One app is apply the update. So if it hasn't already applied automatically, you can just go into your app store and make sure you have the most recent version. Or you can go to the website, which is one.telushealth.com. As a starting point, once you get to either of those, under login, it's really important that you go to login and not sign up. So go to login, it will ask you for a username, which is municipal, and then it will ask you for a password, which is wellness with a capital W. The password is case sensitive, so make sure you do have the capital W on wellness. And just highlighting some features on the app or website. So it's the same experience regardless what method that you're using, but you'll land on a support and resources tab. It has lots of articles, videos, podcasts. They're divided up into different topics: health, life, family, money, and work. So you can navigate that way. Again, a lot of us turn to Google for these things. We've already done that work for you. We have validated articles and videos that you can tap into from your phone or the website. And then the next slide, please. Under the Well-being tab, the navigation bar is at the bottom of the app, but at the top of the website. But under Well-being, you'll see an option for Care Now. Care Now are self-directed clinical programs. There's 20 different topics. You see some of them listed on the screen there. We do help with more of those mental health crisis topics like anxiety, stress, depression. But we also have parenting, working from home. There's a nutrition one, a financial one. So lots of options there. Like I said, they are clinical programs. There's different modules, so it will save your work as you go through those modules. And an option for people that might not be comfortable in that one-on-one counseling setting, but do want those resources. It is important to note that as soon as you click on that Care Now button, you will be asked to create your own username and password. That is part of our confidentiality. Because these programs are clinical, we need that extra layer of security for you to log in with your own email and your own password. It doesn't have to be your work email, it can be a personal email that you choose to create that profile with. And next slide, please. Also on the website, it might be my favorite part because I do a lot of online shopping and you guys have a great plan because I heard Brad mention some discounts earlier and we have discounts as well through our website under that perks tab. So if you are looking for, or if you are doing any online shopping, you're looking for a discount, I would always go on the website, see if the store that you're shopping at is listed there. And it's a simple click through. It will say what the discount is. You click on the offer, it will take you to that retailer's website. But with Christmas coming up and the holiday season, I think it's a great place or a great option to keep in mind as we're doing some online shopping there. And I think we have over 200 different retailers and they're always changing, so keep checking back. And then just to conclude, I wanted to put the phone number up there. However, I see that that is not the right phone number. So I apologize. We will fix that and get you the right phone number as we send out the slides. The username and password, though, is correct. And if you do have any promotional material from before that has the phone number, that is the correct one that you should be using. And with that, I will pass it off to Jacqueline, who will take you through the virtual care piece and the telemedicine.
Hi, everyone. Welcome to On-Demand Virtual Care Anytime, Anywhere. Brad, if you please, you could go on to the next slide. So basically what we see here is what it would look like if you had to go, you got sick, you needed to go make an appointment with your doctor. What we see is that 73% of consults are initiated during the workday. So what happens with virtual care is that if you're sick, you're staying at home, you're getting on your computer, going on the app, and you're basically, or on your phone, and you're basically reaching out to our team. And within the same day, you are actually still at work and waiting to, let's say, speak to a healthcare professional. And within a few hours, you're going to get a response rather than having to lose time running out. Let's say a kid gets sick, you have to run to a clinic or to the emergency. This way, you can just start your consults online if it's, obviously not urgent. What we also see with virtual care is that 72% of patients without virtual care would have gone to a medical clinic, and 19% to their family doctor, and 12% to the emergency room. Brad, you can move on. Thank you. Okay. So telehealth virtual care offers you the ability to see a clinician virtually 24 hours a day, 7 days a week. You can access the service anywhere in Canada in both French and in English. With virtual care, you have access to a whole range of support, including medical advice and diagnosis, primary mental health care, referrals to specialists. You can refill old or new prescriptions and also get lab work requests. Virtual care isn't a replacement for the family doctor, but if you provide consent, we'll keep your family doctor updated on any changes to your health as you use the virtual care program. So please note that you don't need to have a family doctor to access the service, and you can basically meet with our specialists and they can help you and guide you as well and give you advice. Brad, you can move on. Okay, so this is care right on your phone wherever you are. With virtual care, you have access to consultations 24 hours a day, 7 days a week, with or without an appointment by text or video. In some cases, the clinical team may request a video chat if needed to complete their assessment, and video chats are end-to-end encrypted, and they're never saved on the app. So it's very, very confidential and private. The clinical team will transcribe all consultations, and you can review them at any time by clicking on the history icon. Okay, so we're going to just go on to some examples on the next slide and how to use virtual care. So take a closer look at how you can use virtual care. Some common reasons for consultations might include respiratory issues such as respiratory tract infections, pharyngitis, skin concerns such as rashes, acne, atopic dermatitis, genitourinary issues such as urinary tract infections, vaginitis, and sexually transmitted infections. People also present with digestive issues such as gastric reflux, diarrhea, constipation, mental health issues, concerns such as anxiety, depression, and insomnia. So our clinicians are there to provide referrals to external medical specialists, such as a cardiologist or neurologist if needed. They also have a unique access to a bridge program, which they can consult with specialists and help support complex cases while you wait while you wait for in-person care. So note that virtual care can address many health concerns, but some situations are not intended for virtual care. So we have to stress that virtual care is not meant for emergencies. If you have an emergency, you must call 911 or go to the nearest emergency room. So if your clinical team determines that your situation is an emergency, then they're going to guide you to go to the emergency room. So while they can support many new and refill prescriptions, our care team does not prescribe controlled substances, including stimulants such as ADHD medications, narcotics, opioids, benzodiazepines, cannabinoids, or barbiturates. So if a clinician determines that you require medication that isn't prescribed through virtual care, they can help you to navigate local healthcare services to get the care that you need. And lastly, virtual care diagnostic and lab requisition support does not include CT scans and MRI, so that's also an important thing to note. Okay, we can move on to the next slide. So to better understand what it's like to access virtual care, let's explore a few examples of what an interaction might look like for some common concerns. Okay, please note that every situation is unique, and these examples are simply intended to help familiarize yourself with the service. The screen on the left features Edward, who has a history of anxiety. He texted with the clinician to share his concerns about his feeling stressed and not sleeping well. And after getting some more information, the clinician asked if he was comfortable to start a video chat for better assessment. Our nurse practitioners can provide primary mental health support 24 hours a day, 7 days a week by text and video, so you can get the help you need at any time and without an appointment. And of course, you have the EAP service, so that's going to help in this regard as well. The middle screen features a member who started consultation because they were running out of their hypertension medication. So the clinician asked them to text a picture of their latest blood pressure reading to complete an assessment. And based on the assessment, the clinician sent a prescription to the member's pharmacy of choice for pickup at their convenience. And then the screen on the right shows a member having a text consultation for a rash that developed following a hike. And the clinician asked them to send a picture of it and was able to recommend an over-the-counter cream to help with the rash. So pretty quick service, and the patient didn't have to leave and was able to work their day and get prescribed the medication that they needed. So we can move on to the next slide. Oh, you already did. Sorry about that. So now that you know what virtual care is and how you can use it, we're going to walk through some steps to get your account set up so it's ready when you need it. You can scan the barcode over here, and we're going to send these out to you to make it easy. And then what you're going to do is you're going to sign up, and you're going to enter in your email address that you want to use to set up your account. So you're going to select continue. And then you're going to select your province on the next place where you're going to put your province in. And then the next slide, you're going to write, I'm eligible through my group or individual healthcare plan option. Okay. You can move on to the next slide. Okay. So Brad, you mentioned that, you're going to put in the 9455 number for the group number. And your coverage identifier is the first 9 digits of your MediV Blue Cross ID number. Okay, so you're going to put that in. And then afterwards, you're going to select the next tab, and you're going to get a unique activation link sent to your email address. And then you're going to be able to go in and basically set up your account. So when you receive your TELUS Health Virtual Care Welcome email, it's recommended to open the email on the device where you plan to access the virtual care app. So I use my phone, and I like to access the app through my phone. And then you're going to click the activate. So I go into my email, and basically that activation email came in, and I'm going to go into my email, click the link, and it's going to take me in to set up my account. I'll validate my email address, activate my account, and follow the links provided to find TELUS Health Virtual Care app on Google Play. So here I really want to stress, because there's many different apps. You know you have the TELUS one for the EAP. There's also a My Care app. What you want is you see the actual stethoscope with the heart, and it says TELUS Health Virtual Care. That is the app that you need for TELUS Health Virtual Care. it's a common mistake that people go in and they use the wrong app. So just make sure that you use the specific app to get into the application. And then all you need to do is once you're in, you're just going to log in with your credentials. So the email address that you used will be able to help you in the password that you set up as well, and you're good to go. We can move on to the next slide, please. So the virtual care account includes coverage for your spouse, your partner, and dependent children. So any child that is under the age of 26 whose permanent address is the same as yours. So even if they're off at university and they have the same address, their permanent address, so their mail comes home to you still, they can still have access to the system and as a dependent. And basically, we have some information on how to add your family members, and we have some wonderful news. So right now, as it stands, you can invite in one adult member. So that would be either a dependent in Quebec would be an adult child is considered 14 years old. Outside of province, they're 16 years old. So you can only invite in, like, let's say I want to invite in my daughter who's 14. I can't go ahead and invite my husband in as well. But we have a Halloween gift coming on October 31st where everybody will be able to add in as many dependents as they like. So that's coming on October 31st. But in the interim, if you do have people that are trying to get their dependents set up, and they have, like, they've already invited in their husband, for example, and they want to invite in a couple of adult kids, they do have to start a consultation to let our team know. And then what will happen is our team will go ahead and invite in that adult member due to privacy restrictions. Okay. So basically, for the dependents under 16 or 14 in Quebec, the private tab will say you will select Manage Family and then click to add a child and add their information. And they do not require separate accounts, of course, if they're under the age of being considered an adult. So in the province of Nova Scotia, will be 16 years old and under will be a child. And consultations for children are initiated through the parent's account. Okay, so it could be either yourself or your spouse that initiates the consultation, and the child must be present at that time. And again, the clinician will use encrypted video to see the child, access any symptoms. So it's very, very private and very, very secure. And as I mentioned again, I'm just going to reiterate, adults, including adult children, need a separate account due to privacy concerns. And then, of course, if you want to be there for your child, you can be there. We also had a situation recently where we had a young man that was, he was he was a little bit delayed mentally, and the parent needed to initiate the consult and speak to the doctor on his behalf because he had these restrictions. And that's not a problem. You just start your consult and you explain that to the clinician, and they will definitely help out that family with respect to that child that needs the care, or that adult member that needs care. It's not a problem. And basically, we have an additional help support line. So this is our technical support team. They are absolutely wonderful. If, for example, somebody, they're trying to log in, they're having an issue, there's something going wrong, we encourage you to have, whether it's your employee or an employee, to reach out to our help team for the technical support themselves. And really, the help team will help them get into their account and help them with whatever technical issues that they're having. Sometimes it's with respect to using the wrong app. Sometimes it's because they had previously had an account set up with TELUS through another company. Let's say they were with, Walmart, for example. Now they've moved over to Lunenburg, for example. I love that example. That's my favorite place. So they do have to call the technical team so they can merge the accounts and have the history of your medical history embedded into the account. And that concludes the TELUS Health virtual care component of the presentation. Thank you so much.
Okay, so before we open up the floor to some questions, I just want to thank the speakers and all the participants, of course, for attending. A lot of really good information and tools. I'm actually honestly blown away